Ma'am, I'm Reference Nervasa from BSN1B, and today I'm going to demonstrate how to perform the proper assessment of male genitalia. What is the purpose of this assessment? The purpose of this assessment is for routine screening to determine the client's eligibility of health assurance, for acquiring a new job, and lastly, for the client admission to the hospital. For that, I'm going to gather all the materials needed, including the BP apparatus, thermometer, pen light, drape, screen, tongue depressor, nose speculum, otoscope, stethoscope, percussion hammer, vaginal speculum, gloves, and gowns. And then, before the assessment, it is important to provide client privacy by closing all the curtains, windows, and doors. And of course, it is important to perform hand washing before and after the assessment. Before the assessment, we need to introduce ourselves first, identify the client, and explain the whole procedure that we are going to do and how he can cooperate. So, good day po, sir. I'm Reference Nervasa, your student nurse for today. May I know your name and age po, sir? Okay. So, sir, today po I'm going to assess your male genitalia. So, in order to do that po, sir, I'll be needing your cooperation po para mas maging accurate po yung gagawin nating assessment. So, bago po tayo mag-start, sir, may itatanong lang po ako sa history niyo po, sir. Is that okay with you? Okay po. So, sir, pag umiihi po ba kayo, sumasakit po ba? No po. May abdominal pain po ba na nararamdaman kayo pag umiihi? Po? Is there any swelling po na nakakapaan nyo sa like bukol po, sir? Does your family have nephritis, malignancy, or prostrate po, sir? No? So first that I'm going to do is to inspect for the distribution, amount, and characteristic of pubic hair. For man, it must be a diamond shape and observe for nits, lice, and rashes on the hair. Inspect for the penis shaft and glands for lesions, nodules, swelling, and inflammation. And lastly, inspect for the urethral meatus for swelling, inflammation, and discharge. And the normal location of the uterine should be at the center. For the palpation, we need to use the gloves. Make sure before using the gloves, we need to perform hand washing. So in the palpation, I'm going to use the sense of our touch. Palpation po, I'm going to palpate the penis for the thickening, tenderness, and nodules. Palpate for the roughness, texture, and mobility. Palpate the scrotum to assess the status of underlying testes, epididymis, and spermatic cord. Palpate for the both testes. After the assessment, we need to thank our patient for his cooperation. and cover the patient. And document the findings. Like I said earlier, it is important to perform hand washing before and after the assessment to prevent cross-contamination of microorganisms from nurse to patient and vice versa. After the assessment of male genitalia, I've done doing the inspection palpation. I can conclude that there is no ulceration, inflammation, and any kind of problem.